My name is Gede Dhananjaya with the last three digits of my student ID is 075. So now I'm about to explain the background of our study. It's about the cerebral vascularization, which is a specialized vascular structure that plays an essential role in ensuring normal brain function. Its anatomical and physiological aspect certainly have a clinical significance that may help physicians in investigate the pathological process that occur in brain. Cerebral vascular damage has been identified as being associated with morbidity and reduced quality of life. In dealing with this issue, understanding anatomy and the physiology of cerebral vascularization is essential to support clinical reasoning in carrying out the diagnostic and management approaches. Based on this matter, our group discussion is interested to make a student project with the topic of cerebral vascularization. And these are the problem formulation, continued by the objective of the study, and this is the benefit of our study. The next topic or the next explanation will be continued by my college. Thank you.
My name is Febryano Adi Prawira with last three digit student ID number is 226. So today I will explain about arterial system. Arteries transport blood from the heart to smaller arteries and arterioles, supplying oxygen and other nutrients. Meanwhile, the heart pulmonary artery transport carbon dioxide-rich blood to the lungs, and the umbilical artery transport carbon dioxide-rich blood from the fetus to the placenta. Arteries branch form smaller branches that are called arterioles. Arterioles generate smaller branches and are intimately associated with body cells known as capillaries. Among the different layers that make up the arterial wall include tunica interna, tunica media, and tunica externa. Also, the arteries are separated into many sections, with the initial elastic arteries being the largest and mainly consisting of elastin and smooth muscle. Secondly, muscular arteries that control blood circulation and distribute oxygenated blood to each organ. Lastly, arterioles are the tiniest arteries that link arteries and capillaries.
Hello, my name is Safrina Putri Donita with the student ID number 198. On this occasion, I will to present about capillary system in anatomy and physiology. In anatomy, capillary are an important element in the cerebral vascular system, which play a role in the exchange of gases, nutrient, and waste product between blood and brain tissue. Capillary carry blood from arterial to venule, and their wall are only one cell thick. Capillary are actually extension of the endothelium, simple squamous lining arteries and veins. In a physiological context, capillary in the brain experience autocontrol, namely an adaptive mechanism that modulates blood vessel diameter according to the metabolic needs of neuron. Thank you.
First, let me introduce myself. My name is Febryano Adi Prawira with the last three digits of my student number 156. Now I'm going to explain about the cerebral venous system. So the cerebral venous system can be divided into two parts, which is the superficial venous system and the deep venous system. Both the superficial and deep venous system will eventually drain into the internal jugular vein. The function of the venous system is to drain deoxygenated blood and drain metabolic waste. Next, I'm going to explain about the superficial venous system. The superficial venous system is composed of three main systems, which is the medial dorsal group. The medial dorsal group drains into the superior sagittal sinus and the straight sinus. Next is the lateral ventral group, which drains into the lateral sinus. And lastly, the anterior group, which drains into the cavernous sinus. Now I'm going to explain about the superior sagittal sinus. The superior sagittal sinus drains most of the cerebral hemisphere, and it starts from the foramen cecum and runs to the internal occipital protuberance, which then continues and joins the straight sinus and lateral sinus to form the torcular hierophyllae. Next, I'm going to explain about the straight sinus. The straight sinus is formed by the inferior sinus, which runs on the edges of the falx cerebri and the great vein of Galen. It runs to the center of the tentorium cerebelli and finally forms the torcular hierophyllae with the superior sagittal sinus and the lateral sinus. Next, the lateral sinus, it receives blood from the brainstem, posterior part of the hemisphere, and the cerebellum. The lateral sinus consists of a transverse and sigmoid portion and extends from the torcular hierophyllae until the jugular bulb. Lastly, the cavernous sinus, which drains the blood from the orbits and the inferior parts of the frontal and parietal lobe. It also drains blood from the superior and inferior petrosal sinuses. That is all from me. Thank you.
Okay, my name is Gusti Ngurah Dinda Pratyaksa with the last 30 digits 112. So I'm going to explain about the deep venous system that are the veins which drain central structures such as the hemisphere, basal ganglia, corpus callosum, pineal limbic system, and the thalamus. And these deep veins are divided into two groups. The first one is the ventricular groups that draining the walls of the lateral ventricles, and this second is the cisternal group that draining the walls of the basal cisterns. And this is about the deep venous system anatomy, and the right pictures represents the deep venous systems, which are consist of the tributaries of the great vein of the galen and the basal vein of the Rosenthal. These are the simplified schemes so we can see more clearly about the ventricular and the cisternal group. So the first one is about the ventricular group that include the caudate vein, thalamic vein, and the choroid veins from the choroidal plexus, which drain into the thalamus striate veins. And there are also the anterior and posterior internal cerebral veins and the common atrial vein, which is formed by the medial and lateral atrial vein that drain into the galen vein. So the second one is about the cisternal group, which the drainage area of these groups is divided into the anterior, middle, and the posterior incisional space according to its locations relatively to the brainstem. Also, the basal vein also divided into three segments following those regions division. So for the anterior and middle regions, almost totally are drained by the basal vein tributaries such as the peduncular vein, the middle cerebral vein, frontal-orbital vein, and the olfactory veins for their anterior regions, and the hippocampal veins, mesencephalic veins, and the temporal cortical vein for the middle regions. And for the posterior regions are drained by the galen vein, posterior segments of the basal vein, epithalamic vein, tectal veins, occipital-temporal vein, and the occipital vein, etc. So that's all from me about the venous system of the cerebrals. Thank you.
Good day everyone, my name is Sheila Monica with the last digit of my student number are 2, 2, and 8. So next let's talk about cerebrospinal fluid, about its anatomy and physiology. So CSF is a transparent colorless fluid that resembling plasma that envelop the central nervous system. And the primary roles of CSF include protecting the brain and spinal cord, providing basic immunological defense, eliminating metabolic waste, and also transporting neuromodulators and neurotransmitter. And most of this CSF is produced by a specialized tissue called the choroid plexus that located in the lateral, third, and fourth ventricles. And the choroid plexus is situated in the innermost layer of brain meninges, namely pia mater. And it is also features specialized epithelial tissue known as ependymal. And apicals for surface of choroid plexus are covered with cilia, which help circulate the CSF, and also microvilli, which aid in CSF absorption. And additionally, the choroid plexus also acts as a barrier in the brain, separating blood from CSF and refers to as the blood-CSF barrier. Thank you.
My name is Gusti Aryawangsa with my last digit number is 144. Now I will explain more about the anatomy and physiology of CSF. Cerebrospinal fluid circulation begins with its secretion from choroid plexus in the lateral ventricles, and then it travels to the interventricular foramina to reach the third ventricle. It then passes through the cerebral aqueduct to enter the fourth ventricle and finally reach the subaryonic spaces via a median aperture called Megendi's foramen. The autonomic nervous system and neuropeptides like dopamine and atrial natriuretic peptides finally regulate CSF production. The sympathetic nervous system reduces CSF secretion while the cholinergic system increases the secretion. The production of cerebrospinal fluid in adults varies between 400 and 600 milliliters per day. As individuals age or experience neurodegeneration, the ratio of CSF volume to brain volume tends to increase. That's all from me. Thank you.
Hello, let me introduce myself. My name is Erika Luis with last digit name 089. Here I'm gonna explain about the risk factor of cerebrovascular damage. First of all, the etiology of cerebrovascular diseases contributes to therapy. Therefore, knowledge of risk factors is crucial for both prevention and early treatment. There are several risk factors contributing to cerebrovascular diseases. First is a person's age. As individuals age, pro-inflammatory cytokines rise and proteins like amyloid build up in the brain environment, which causes cellular and molecular abnormalities. Next is physical exercise. Contrary to those who frequently exercise, Those who do not consistently engage in physical activity have a higher chance of developing cerebrovascular illness. It might be because exercise can successfully control blood cholesterol levels and blood pressure, lowering the risk of cerebrovascular illness. Hypertension is also one of the major risk factors. In the previous studies, it is at responsibility for approximately 54% of strokes and 47% of incidents involving ischemic heart disease globally. Besides that, diabetes can result in atherosclerosis of blood arteries and thickening of their basement membranes. Moreover, smokers have been shown to result in cerebral vasodilation as well as impaired blood-brain barrier integrity, making them more susceptible to bacterial and viral inflammatory neuropathologies than non-smokers. Lastly, all forms of cerebral vascular disease have a significant heritability. A family history of stroke is linked to a threefold increase in risk. That's all from me. Next slide will be presented by my colleague. Thank you.
My name is Putra with last three-digit number 083. Pathophysiology. Normal blood flow to the brain is often disrupted in the case of the cerebrovascular disease, which can result in neurological issues like stroke, brain injury, or other neurological problems. Cerebrovascular disease can be broadly categorized into two main types: ischemic damage and hemorrhagic damage. Ischemic damage: if an artery supplying a portion of the brain is suddenly closed or noticeably narrowed in diameter, brain ischemic will result. The ongoing side effects of the brain ischemic include being neuronal shrinkage and death, gliolysis with astrocytes and volume loss. These difficulties are brought by the irreversible brain injury and are less common pathway to the necrosis. Hemorrhage damage separated into primary injury, which refer to the initial harm caused by the hemorrhage itself, and secondary injury, which refer to the harm caused by the downstream pathway that were triggered in the presence of the intraparenchymal blood. Primary damage happens right away after the hemorrhage damage and lasts for the first few days. It is caused by the mass effect of the initial hematoma and hydrocephalus. The activation of harmful pathways such as inflammation, iron and blood-related toxicity, and oxidative stress leads to the second injury, which manifests over a period of 2 weeks.
Hello all, let me introduce myself. My name is Kalista Morai Manurung with the last digit number 208. Now I will explain about the complication in cerebrovascular damage. Cerebrovascular damage refers to harm to the blood vessels in the brain, which can have severe health consequences. Stroke is a primary complication, either ischemic due to vessel blockage or hemorrhagic due to vessel rupture, leading to symptoms like muscle weakness, speech difficulties, and potential death without immediate treatment. Cerebrovascular damage can result in brain function disorders like aphasia, cognitive impairment, and varying degrees of disability, often requiring physical therapy. Conditions like heart disease and high blood pressure can heighten the risk of cerebrovascular damage. The quality of life for individuals experiencing cerebrovascular damage can be significantly impacted. The brain is highly vulnerable to oxygen deprivation, which can lead to ischemic or brain infection or permanent brain cell death. The causes include vessel blockage, rupture, vessel enlargement like aneurysm, or brain edema or fluid buildup in the brain tissue, all of which can permanently damage the brain and affect cognitive and physical function. That's all from me. Thank you.
Hello everyone, my name is Felix Djuanda with the last digit of my student number 117. Today I will explain about the diagnosis methods for the cerebral vascularizations. The first thing we can consider is we do anamnesis to find the signs and symptoms that exist in the patients. The next thing we should do to confirm the diagnosis is non-contrastivity. This is the gold standard for diagnosing cerebral vascular damage. And then the next thing we can use is MRI and perfusion CT. There is some variation of MRI that we can use. For example, if you use weighted imaging that can help to choose the best therapeutic choice for the patients. The next things we can use to help diagnosing a patient with cerebrovascular disease is blood biomarkers. This is a novel technique to help diagnose by identifying by some uh, chemical that exist in our body.
Hello everyone, my name is Anna Agung, istri Arya with my last three-digit register number is 233. Now I will explain about the treatment and prognosis of cerebrovascular disease. The treatment of cerebrovascular disease depends on the type of disease the patient has. Therapies that can be used to treat patients with cerebrovascular disease include the first one is medicines. Medicines that can increase blood flow to the brain include blood pressure medicines, cholesterol lowering medicine, blood thinners, and medicine to control blood sugar. The second one is operation. Surgical option that can be performed, namely carotid stent, coil embolization, and clipping surgery. The third one is management of the risk factors, such as blood pressure, diabetes, hyperlipidemia, alcohol, and drugs. And the next one is rehabilitative therapy, such as physical therapy, occupational therapy, and speech therapy as a part of the recovery process. Finding the treatment management for cerebrovascular disease is certainly a huge challenge. Several researchers have reviewed that there is a new target for cerebrovascular disease therapy, namely GPR39, which is a member of the protein G protein coupled receptor family. And the next is prognosis. The prognosis due to cerebrovascular accidents are likely to remain high. Patients who still survive will of course experience a prolonged recovery and the risk of other complications. Maybe that's all I can say, and for the next explanation will be explained by my friend. Thank you.
Hello doctors and friends, my name is Nilam Nirmala, last digit number is 106, and in this video I will summarize our presentation in several points. Arteries serve as vital conduits carrying oxygen-rich blood from the heart to arterioles and body cells through capillaries. They consist of three layers and vary in size, playing distinct roles in circulation. Cerebral capillaries, part of the brain's vascular system, enable gas and nutrient exchange while maintaining the blood-brain barrier. They adapt vessel size for neural metabolism and link neural activity to blood flow changes. The cerebral venous system comprises the superficial and the venous system, draining the oxygenated blood and waste from the brain. Unlike arteries, cerebral veins lack muscular tissue and valves, ensuring efficient drainage. Cerebrospinal fluid surrounds the central nervous system, shielding against impacts, providing immune defense, and eliminating waste. Cerebrovascular disease, a result of vascular bleeding or ischemic infarction, is influenced by age, exercise habits, hypertension, diabetes, smoking, and family history of cerebrovascular disease. It compromises the blood-brain barrier and activates brain cell, worsening cognitive outcomes. Cerebrovascular damage disrupts blood flow, causing conditions like stroke. Symptoms of cerebrovascular damage include weakness, aphasia, and ataxia. Diagnosis involves the National Institute of Health stroke scale and neuroimaging through CT scans and MRI. Diffusion-weighted imaging is especially valuable for early ischemic lesion assessment. Cerebrovascular damage in the brain leads to severe consequences like stroke. It can result in varying levels of disability, requiring physical therapy. Treatment focuses on restoring blood flow using medication, surgery, and rehabilitative therapy. Prognosis varies with lasting disability often seen. And we also recommend that deeper knowledge of cerebral vascularization is required to aid in ensuring the identification of cerebrovascular damage. Understanding the disease treatment is also crucial for the patient rehabilitation. I think that's all from us. Thank you for listening.